Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Welcome to Health Impact Live, Digital Health Talks. We're here with BJ Moore from Providence. So BJ, I love your backstory. Tell us a little bit about yourself and where you were working on before you got to Providence.
Sure. So long journey to get to Providence in healthcare. I was at Microsoft for 27 years, a lot of different roles. My last role there was Vice President of Engineering for Azure. Fantastic company, but after 27 years, I was ready to do something different. Still too young to retire. My wife convinced me to come to Provider Healthcare and help do the digital transformation. So I joined Providence 5 years ago, and it's been a fantastic journey so far.
Yeah, no, I love Providence and especially the innovation arms that you guys have doing all kinds of new things. So we'll get into the nuance and DAX conversation, but what have you noticed as some of the biggest learnings from what you took from Microsoft that you brought into Providence? And then once you were at Providence, there was probably a lot that you've learned that, man, I would have never known this if I was at Microsoft. Yeah. What does that sound like?
Yeah, so when I joined 5 years ago, the very first thing I did is I visited most of our hospitals, clinics, met with administrators, patients, caregivers. And one thing that was crystal clear is Providence and healthcare in general was about 15 to 20 years behind every other industry. What technologies we're using, how we were using the technologies, our engineering processes, the lack of use of cloud or modern tools. So it's crystal clear that we needed to catch up. At the time, my premise was that healthcare was just change adverse, maybe risk adverse, and that's why we were so far behind. But my big epiphany at Providence was just we were missing a North Star, a vision. And with my tech background, I was able to bring that into Providence. And over the last 5 years, we've not only done a major digital transformation, but we've caught up that 15 and 20 years and passed up, frankly, a lot of Fortune 100 companies that'd be envious of the modern stack, the modern technologies that we've been able to adopt.
No, that's perfect. And so if you think about where you started at Providence 5 years ago, you could have done 100 different things when you arrived.
Yep.
So talk about what were some of the key priorities, and that'll bring us into where we are today with your big announcement here.
Yeah, 5 years ago, I came up with 3 strategic pillars: simplify, modernize, and innovate. Simplify, we had 4,000 applications. We weren't going to create great patient and caregiver experiences with 4,000 applications. So simplify is how do we retire the non-essential apps? How do we go to standard platforms like Epic, Oracle Cloud, Microsoft 365 Stack, Nuance? Modernize was how do we move to cloud native applications? How do we start leveraging the cloud for our hosting and data centers? We chose Azure. And then also how do we do modern engineering, DevOps, Agile, everything we were doing before where it was waterfall, 6, 12-month releases. So we had to modernize not only our infrastructure, but the way we delivered services. And that really allows for the innovation, right? It's almost like Maslow's hierarchy of needs. Simplify is like eating, breathing, sleeping. Modernize is like sending the kids to school, and innovate is like self-actualization. And that's really what we're able to do now because we've invested over the last 5 years in simplify, modernize. We really can focus on innovate. And it's a perfect time, right? With generative AI coming into focus 15 months ago, we're now poised to take advantage of it instead of doing a lot of housekeeping that I think a lot of other health systems are having to do.
And so Providence has prioritized ambient voice, going from voice to text, voice to EHR, voice to many things.
Yep.
Why is that so important to Providence?
One thing I heard 5 years ago, I heard 2 things. One, the onboarding experience was horrific. It took our caregivers a month to be productive. But the other common thing I heard was just the interactions with electronic health record. That was burning out our caregivers, and we needed to do something about it. And it was actually at HIMSS 5 years ago that I met Nuance for the first time, saw their early DAX prototypes, and was just absolutely blown away. So I had heard from our caregivers that the EHR and documentation was a core issue, and I was lucky enough to stumble upon Nuance, who hadn't been acquired yet by Microsoft, and really forged a partnership. So we started that partnership 5 years ago, and it's really been a 5-year journey to culminate where we are today.
What does the scale look like for your implementation?
I can't keep track of the scale. I know Nuance and Microsoft tells me that Providence is the largest DAX Copilot user in the world. I can't give you the exact count just because that number changes, but we went live 3 weeks ago and really proud because we had to be on Epic Hyperdrive to really get that rich capability. And then again, that Nuance partnership for so many years paying off with DAX Copilot. So all the stars appear to be aligning, but it's really been a 5-year plan, a 5-year journey to get here.
Yeah, and so as you are embarking on this mission, what are you surprised by as far as maybe utilization by physicians, either acceptance or non-acceptance? What are you seeing just on the ground?
As it relates to DAX itself,
Yeah.
the adoption's good. There's always people that are change adverse, but generally we've got a set of physicians that are really, right, they want to make their lives better. And if we're bringing a technology to them that makes their lives better, the acceptance has been good. Because it was a 5-year journey, the early iterations were tough, and so we had to pick the right doctors to partner with to help us on that journey as we evolve the product. 5 years later, the product is much more mature. The adoption, the change management, the acceptance of the tool is much better. And when we survey our physicians, they would absolutely not allow us to take this away. It's now become an integral part of the work that they do every day.
And if you assume that ambient voice is, in quotes, solved, and of course it'll never be solved because
correct.
it's a journey.
Correct.
But if you think of that as being now a met priority, what
Correct.
are your next 2 or 3 priorities that you're focused on?
Yeah, and it's definitely not a Met priority. What are the next set of priorities? It's really how do we take this new powerful AI tool. We've been using AI for years, basic machine learning, predictive modeling, natural language processing. We've already been doing that. But with generative AI and these large language models, it's just really changing the way we're doing things. So I'm happy to say we already have 4 things in production. I could share with your listeners what those are. So the 4 are, first one, we developed a tool called Providence Chat. I can talk about generative AI till I'm blue in the face, but people don't get it. So what we did is built Providence Chat, which is basically a private version of ChatGPT. We took the Azure OpenAI, wrapped it with a set of APIs, and we allow then our 120,000 caregivers to interact with it safely in a secure way. The data doesn't go back to OpenAI or Microsoft. It stays within Providence. And now people can see for themselves the power of it. They can use it to do a recipe, to write their job description. I use it to write my personal job performance review for the year. It's fantastic. And so people can see firsthand the power of it in a safe manner. But then my IT team sees all the prompts, and we know exactly what people are asking. So we can see the most common scenarios. So if we see people asking over and over again to write job descriptions, we can take that and partner with Oracle and bake it into our ERP. And so we can use that to create job descriptions within the workflow of the application. Or if there's some clinical questions that people have, we can partner with Epic and figure out how to integrate it there. So it democratizes OpenAI, but it does it in a safe way that we can then capture. So that's one. 2, we had a chatbot called Grace that our patients interacted with. We've enhanced that with generative AI capabilities. We've seen a 30% reduction of the number of tickets or messages that they send our physicians because they're able to self-serve more effectively. So it's good for the patient, but it's good for our overworked doctors. And then we built a tool called Provaria for our doctors to actually manage their inbox. When we look at our physician inbox, it's taking about 3.5 days to get through their inbox, which is a long time. It's a lot of effort for the physician, but if you have a critical issue as a patient, 3.5 days is a long time to wait. So we're using generative AI to triage those messages and putting the most important messages up front. A real example is a patient was having suicidal ideation. And in the old process, it could have taken the physician 3.5 days to get to that. With generative AI, it knew it was a top priority, put it in front of the physician. They're able to reach out to the patient, intervene, and potentially saving a life. And then the final solution we have is called MedPearl. It's for physicians and more effective referrals. We're finding that the effectiveness of referrals or the quantity of referrals was inappropriate. And with MedPearl within the physician workflow, they either can self-serve and solve their own problems, or when they do refer to the physician, they refer to the right specialty. I'm proud that we're not only just talking about generative AI, but we've got 4 real solutions in production that are being used by hundreds of thousands of people.
No, so it sounds like you guys definitely didn't take the wait and see approach.
No.
Now you've got 2 hats that you've worn, one at a big tech company, then you've got the 5 years at Providence now.
Yep.
How would you suggest to executives at hospitals about this wait and see attitude? Lots of them have this wait and see right now. Is that dangerous? Is it a good idea? What are your thoughts?
Yeah, I think it's dangerous. It's such a hot technology. You can't wait and see. Take ChatGPT. A lot of health systems are just blocking it. Oh, we don't want our employees using ChatGPT, so they block it. People are just going to go home on their private network and use it. And so that's why we built Providence Chat. We know you're going to use it, so allow us to let you use it in a safe way. So yeah, I would say embrace it. You'll notice the examples I gave, none of them were making clinical decisions. They're all assistants or helping assistant to a patient or assistant to a doctor. And we've done that consciously. There's so many administrative functions that we can use this new technology for, really perfect it there, have real impact to the productivity of our caregivers, outcomes for patients. And let's perfect the technology. And as it perfects, we can slowly move to more clinical scenarios. Because we're only going to get a first impression once with our patients. We're only going to get a first impression once with our doctors. We don't want to stumble with this new technology. So so my advice to your listeners are embrace the technology, but you can embrace it in areas where it's low risk. So if you do stumble, it doesn't have a high impact.
Yeah, and I get the sense that there are a lot of startups probably knocking on your door saying, hey, we've got this AI, we've got that AI.
Yeah.
One of the things I love about the AI platform shift, if you see it as a shift, is that incumbents have more power because incumbents have all the data, right? Providence has all the data. And so introducing AI into your data streams with your own developers, with your own innovators, that's what I like about Providence. You're not waiting necessarily for the next big thing to come from whether it's Microsoft or anyone else. You're just doing it on your own. Is that something that only Providence can do, or it's probably possible at other institutions?
It's possible to others, and it goes back to my first two strategic pillars around simplify and modernize, right? By having big partners like Microsoft or Nuance, Oracle, ServiceNow, Epic, we can write on their, I call it the easy button AI solutions, because we're on a single instance of Epic, right? We fully embraced Epic for all of our patients. As Epic innovates on the AI front, the easy button is we can just then choose to turn on those AI capabilities. We don't need to develop them ourselves. We're already on the version. We're already on hyperdrive. We can already take advantage of these. So we can just, at our pace, start to consume these new AI features, which is great. So right now, I've got a long line between all those partners of all the new AI capabilities, right? So I talked about the 4 solutions we already have in production. But in 6 months, we're going to have a ton of Oracle things in production. We're going to have a ton of Epic things in production. We're using Microsoft Copilot. So with very little effort, we're going to light up our enterprise with a lot of rich AI capabilities because we picked modern standard platforms and we picked good partners, good strategic technology partners that are embracing AI. So we can ride on the coattail of their innovation.
Yeah, that makes a ton of sense. Earlier today, I interviewed John Halamka from Mayo, and he was talking about how they've tried to reduce their risk in using AI in clinical by anonymizing and de-identifying data and using that in the AI engine, because if it's anonymized or de-identified, it wouldn't necessarily, even if it went crazy, it wouldn't be giving anybody else's data out. What do you think about that idea, and is that something you would be trying at Providence as well?
Yeah, so we created a data consortium called Truveta. Providence was the founding member of that about 3 years ago. There's now 35 other health systems. So that's our arm where we're going to be innovating through Truveta and on data, and they're taking that exact approach, right? It's the data from 35 health systems, but it's all been anonymized. It's all been standardized and cleansed and deduped. And then that kind of innovation can be built there. The large language models, the correlations, the things that we as human beings can't effectively do, can do it at scale, but it does at scale on the collected data of about 100 million patient records. And so I absolutely agree with the Mayo approach, but we're doing it at a greater scale through our Truveta investment.
Oh, that's a great idea, pulling together a whole bunch of others just to get a much larger scale.
Yeah, the large data set, and then I really love the diversity, right? We've got patients from Hawaii, Alaska, Texas, all over the East and West Coast. So not only is it a big data set, which hopefully your listeners all know, the bigger the data set, the more effective these models are, but it's a very diverse data set, right? The individuals in there are diverse themselves.
No, fantastic. So just in the last couple of questions then, if you think about the way that Providence is attacking the next few priorities, what in your infrastructure, the blocking and tackling kinds of stuff, needs to be upgraded? Before you can do all the modern stuff, you got to do some basic blocking and tackling?
Yeah, so if I go back to my kind of framework around AI, the easy button kind of things, if you pick the right partners, I think you can do a lot of AI innovation, like through Epic without investing in your infrastructure. But if you're doing the bespoke work that we're doing, you really need to be in the cloud, right? The cloud is the only place you really effectively do AI. It's the only place you have the compute and the storage needed to do that. So those are shortcuts you can't take as a health system. We've been on that 5-year journey. All of our data's in the cloud. all of our major systems are in the cloud. So you do have to make that investment to really take advantage of this kind of wave of technology.
Yeah, and that's really the big advice is that at HIMSS we're seeing that everybody's so focused on AI, cyber, etc., that they're forgetting that there's a lot of regular day-to-day blocking and tackling, day-to-day telecom, day-to-day kinds of tech support that have to be done.
Back to my Maslow's hierarchy of needs, right? If you're not eating, breathing, sleeping, you're not self-actualizing. And same thing with innovation. If you haven't taken care of those foundational items in your technology stack, you really can't do the rich innovation that your system needs to do.
Perfect. Just so on the way out, what's something that you've seen here at the conference that maybe has wowed you, or you're like giving a second thought to because you hadn't thought about it before?
God,
like
I wish I said I had the time to have gone around and seen this. My favorite thing to do in years past is to walk all the booths. I normally put on 10, 12 miles. Unfortunately, so far, I've just been in interviews and meetings, so I haven't had a chance to do that. So I haven't seen the wow technology, but I hope to be able to walk the floor and see that and be wowed. So that's nothing awesome to share yet, but hopefully I'll have something by the end of the week.
Great. All right. Thanks, BJ. Really appreciate your time, and we'll catch up with you after the event so that you can tell us what you did learn here.
Awesome. Thank you for the opportunity to speak. Appreciate it.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactslive.com.